Dr Cheong Wai Kit, a member of the Public Education Committee in the Singapore Cancer Society, joins me now. Cancer seems to be an increasingly common problem in developing countries and also Singapore. Part of bad habits contributing to this?
Okay, first of all, let me clarify that not all cancers are on an upward trend in Singapore. Certain cancers are on the upward trend, such as breast cancer, prostate cancer, uterine cancer, ovarian cancer, but some actually has plateaued, seems to have plateaued, such as colorectal cancer. Some actually on the downward trend, cervical cancer and lung cancer. Now, lifestyle, like you say, modern lifestyles, like what I mean, is usually associated with unhealthy diet, okay? Lack of exercise, living a sedentary lifestyle, consuming alcohol, and smoking, and the choice of having children in the later age. Now, some of these cancers are actually we call lifestyle cancers, such as prostate cancer, colorectal cancer, and breast cancer. They actually associate with these lifestyle habits of ours.
All right. Now, there are three types of cancer screenings that that the society has chosen to be given free. Why these three cancers?
Now, the three cancers that we have chosen are actually breast cancer, colorectal cancer, and cervical cancer. Just to mention, you have mentioned earlier, Pap smear for cervical cancer, fecal immunochemical test for colorectal cancer, and mammogram for breast cancer. Now, why these three? Breast cancer is the #1 cancer among females. Colorectal cancer is the #1 cancer among males and females. Cervical cancer is one of the top 10 cancers in Singapore, and is quite prevalent. Now, the other thing is that these three tests to detect these three cancers are actually very effective, and it's actually recommended by the Academy of Medicine of Singapore.
Right. And any plans then to extend it to those above 50 years old?
Now, what Singapore Cancer Society has done all these years, actually, they actually committed to detect, create awareness and promote screening for 50 and above. We have not neglected 50 and above. Just that this year, Singapore Cancer Society has turned 50, and they said, now let's target the 50, those are age 50 this year. Why? Is because that 50 is a special number for Singapore Cancer Society for the commitment. 2 is that 50 is a time that now we start thinking that now we have to be serious, we have to think about screening, right? That's why 50. And now we are targeting this group of 50 so that those are 50 now, they're approaching 50, they think about screening. But those who are above 50, they have actually know about this, and we have actually created all this awareness all these years for them.
Now, speaking, aside from screening then, do you have then general advice for people who are concerned about cancer rates?
Sure. I think what I usually tell my patients are, #1, live healthily, right? Live healthily means that eat a healthy life, eat healthy food, #1, exercise, okay? #2 is that so when you turn 50, think about screening, right? Screening is the best way to go. And lastly is that now be aware of the symptoms, cancer, okay? Certain early signs and symptoms of cancer, so that you will once, if you have it, or, just quickly seek medical help.
All right, Dr. Cheong, thanks for joining us. Thanks for sharing. And that was Dr. Cheong Wai Kit from the Singapore Cancer Society on combating the disease.